Welcome, guys. Welcome to the Radiology in ENT Series 3. We have already covered the basics of anatomy of paranasal sinuses, and we discussed the important topic on juvenile nasopharyngeal angiofibroma in our last class, in the second part of the series. Let's move on to the third part of the series. In this class, let's get into the little anatomical part of the paranasal sinuses. This is especially a favorite question of AIMS exam, and it's quite complicated to understand. And we have very limited time, so I've tried to simplify this topic. Uh, and I've already told you in my first class that we are going to discuss about the cells, anti-ethmoidal cells in detail. And AIMS has a pattern of asking different anti-ethmoidal cells, and they want us to identify which cell is where and how to identify them on CT. So they just point out a particular structure on CT and they've asked us to identify which anti-ethmoidal A cell that is. Okay. So let's try to focus on the anatomical aspects of paranasal sinuses in detail in this class. Before we move on, I kind of missed this question when I was discussing about the views of X-rays. Anyways, we have already discussed the topic. Let's just go through the question once. This was asked in previous NEET exam, I think 1 or 2 years back. So the question goes like this. A radiogram shown below is done for better assessment of frontal sinus. What is the name of the view? It's a simple, straightforward question. We already know that frontal sinus, we use Calvel view or also called as fronto-occipital. Now there's a small division. Waters view is for maxillary sinus. Waters view is for maxillary sinus. Hertz view is for sphenoid sinus. Hertz view is for sphenoid sinus. And PS view, like we already discussed, PS view is nothing but waters in mouth open. Waters view taken in mouth open. And this, we use it also for sphenoid sinus. And Reese view is for ethmoid sinus. And the other views we discussed about were in the ear. The first thing is colors view. This colors view was used for viewing the mastoid air cells and external auditory canal. And Townes view. Townes view was used for internal auditory canal. Again, outdated technique to view the sinuses, the X-rays. We no more use these. So this was a straightforward answer. The answer to this question is Caldwell view or fronto-occipital view. Let's move on to the next question. Yeah, this was what I was talking about. What is the most probable diagnosis based on finding given on the CT scan given below? Concobulosa, nodicell, halocell, and pneumatized superior turbinate. Before we discuss this answer to this question, let's just go through the basic anatomy of the paranasal sinuses. So this is how our paranasal sinus and normal nose anatomy looks like on a normal CT scan. So this will be our inferior turbinate, this being the middle turbinate, yeah, and this is our superior turbinate, and this is our maxillary sinus. And what else can we identify, which we have already studied? This is our orbit. This is the nasal septum. And these are the anterior ethmoidal air cells. These are the anterior ethmoidal cells. Anterior ethmoidal air cells. Before we go to the core of the topics, some basic facts I want to spill right here. At birth, this is again a previous year question. We will discuss it when we are discussing about the anatomy in ENT, the ENT anatomical aspects. So a question in AIMS went on like this: which of the following sinuses is absent at birth? or the question was not this straightforward. There was a clinical scenario given to the question. So basically, they wanted to check what are the sinuses which are present at birth. So at birth, there are only two sinuses present: maxillary sinus and ethmoid sinus. These are present at birth. At birth, these are present. One thing is sphenoid and posterior ethmoid sinuses. Sphenoid and posterior ethmoid sinuses, these are starting to develop at birth. And this is something we are speaking at birth. These sinuses have started to develop. Not well developed yet, have started to develop at birth. But the frontal sinus is present only by middle age. Frontal sinus is the last sinus to develop. Frontal is the last sinus to develop. Frontal sinus is last to develop. We will go through this question when we are discussing anatomical aspects in ENT. But right now, as of now, we guys should know this. So, one more important fact we need to know is that the all the sinuses are a single big cavity. All sinuses, we have two maxillary sinus, two frontal sinus, two sphenoid sinuses, but ethmoid sinuses is a group of air cells. It's not one single air cell or not two just left and right. It is a group of sinuses which form ethmoid sinuses. And one important thing we need to know is that at birth, these ethmoidal air cells are at their anatomical position, but as and when the patient starts to grow in age, these air cells move apart. The ethmoidal air cells, they migrate from the nose and they go to orbit, they go into sphenoid sinus, they go into frontal sinus, they go into lacrimal bone. So these anterior ethmoidal cells, they migrate from their area and they go into different places, not very far away, but somewhere in the region we are very close to the paranasal sinuses. So these are the cells which are very confusing. There are many air cells, but there are only few air cells which we need to know. Important ethmoidal air cells. Important ethmoidal cells. Important ethmoidal cells we need to know are agar cell, agar Haller, Onodi, and Bulla ethmoidalis. These are the four groups of air cells of ethmoidal cells we need to know for exam. These have been asked in different years, and over the years, over the past 10-15 years, these have been asked very frequently. So I thought, and these are very difficult to by heart. Like we can't by heart this because these air cells, like I already told you, they are variable in location. They are not always in the same location, and this is something we can't by heart. So I just thought we'll just go in detail about these air cells. Now let's try to identify these air cells on the CT scan. First air cell. First SL we need to discuss is about the onodi SL. How to identify onodi SL? Onodi SL is present posterior. It's a part of posterior ethmoidal cell. Okay. Coming back, all these are anterior ethmoidal cells. Whatever I discussed, Agarnesa is an anterior ethmoidal cell. Agarnesa is anterior ethmoidal cell. So is Haller cell. So is also agar cell. And so is Bulla ethmoidalis. These are anterior ethmoidal cells. But सिर्फ onodi cells, only onodi cell is a posterior ethmoidal air cell. Onodi cell is a posterior ethmoidal air cell. Coming back to the CT scan, this diagram. Let's first try and identify what all structures we can see. We should first try to identify that this is a sphenoid sinus. So this is the anterior view. We are still in the anterior section. If I am taking a cross section like this, so we are in this area. This is the anterior section. This is where we are looking at this nose right now. If we go a little posteriorly, if we come little posteriorly, that's when we see our sphenoid sinus. So this is our sphenoid sinus. So any air cell, this is our sphenoid sinus, and below this is our nasopharynx. This is our nasopharynx. So this just signifies that we are in the posterior cuts of the CT scan. Now, this sphenoid cells, any air cell which, if they label this air cell and they ask which of the following air cells is present, and they give you four options of ethmoidal air cells, then onodi is the answer. Onodi is present. Onodi air cell Onodi air cell is, it's also called as a sphenoethmoidal air cell. It's sphenoethmoid air cell. It's called as sphenoethmoidal air cell. Okay. So this, and one more important thing we need to remember is that Onodi cell is the one which is, Onodi cell is related to optic nerve. Optic nerve, this air cell is in close proximity to optic nerve and vessels. So clinical significance of this air cell is that when we are trying to operate on optic nerves, suppose patient has a traumatic optic nerve injury and we need to decompress the optic nerve. So when we are trying to operate the optic nerve in the sphenoid sinus, Onodi cells is in very close proximity to optic nerve. So it's very important to handle these air cells during during the surgery to not damage the optic nerve. Okay, the Onodi cell is present posteriorly and it is in proximity to optic nerve and sphenoid. So if you see a sphenoid sinus and nasopharynx and they label a air cell and they ask within these options which of the following is the air cell labeled, Onodi cell is the answer for this. Okay, so which is this air cell. Now all the other cells other than Onodi cells are all anterior cells. Only Onodi cell was a posterior ethmoidal air cell. Now, this, like we can see, this air cell is present in the roof of the maxillary sinus. If this is my maxillary sinus, this is present in the roof of the maxillary sinus, or it is present in the infraorbital region. So this is an infraorbital air cell. This is our halar cell. So halar cell is a, and now this is the anterior cut of the CT scan. So if I'm taking cuts, if I'm taking coronal cuts, if I'm taking cut here, cut here, cut here, this cut is somewhere here. It's the anterior region. It's in the anterior region. So this is our halar cell. Halar cell is nothing but our infraorbital hair cell. Infraorbital hair cell. So, and one more thing we need to know is that when we're talking about this hair cell, like I already told you, it's a variable position. So in this patient, this air cell is present here. So in some other patient, if I take a CT scan, this air cell might be present here, or it could be present here, or it could be present here. These air cells doesn't have a specific location. It is an approximate region. So suppose if you ask me where are you from, if I say I'm from India, so I can be from anywhere. I can be from Mumbai, I can be from Bangalore, so it's somewhere something like that. So I am just from India, I'm an Indian. So Onodi cell is also a sphenoethmoidal cell. It can be present anywhere in the sphenoethmoidal region. So don't get confused that it's going to be present only at this location, at this junction. It's not going to be like that. So in the sphenoethmoidal region, they are going to ask one ethmoidal air cell. That's going to be, the answer is going to be Onodi cell. In the same way, any air cell which is in the infraorbital region and it is in the roof of maxillary sinus, very important, roof of maxillary sinus. There is another air cell which is in close proximity to our, this is the air cell we're talking about. There is another air cell which is in close proximity to orbit. That is our agar nasi. We should never confuse agar nasi with halar cell. So to remember halar cell, just remember it's always present in the roof of the maxillary sinus. It's on the roof of the maxillary sinus. Agar nasi cells. Like I already told you, these agar nasi cells, these are agar nasi cell. Agar nasi cell is in, agar nasi is in the lacrimal region. Agar nasi, it is present in close proximity to lacrimal apparatus. There can also be one more question asked about this is the anterior most ethmoidal cell. This is the anterior most. It is present somewhere here. Somewhere here. So it is anterior most. It migrates the most anteriorly. Anterior most ethmoidal cell. So the anterior most ethmoid air cell. So this is our agar nasi air cell. This is our agar nasi cells. So like I already said, again, don't get confused with the halar cell. So halar cell, if present in this cut, the halar cell is not seen in this patient. Halar cells will be somewhere here, or it could be somewhere here, somewhere in the infraorbital region or the roof of the maxillary sinus. But we're talking about agar nasi cell. So this is the agar nasi cell. This. On the other side, to be a more accurate, more precise, this will be the agar nasal cell on the right side, and this will be the one on the left side. Moving on to the next air cell, bulla ethmoidalis. Bulla ethmoidalis. Bulla ethmoidalis is considered as the most consistent, most consistent, and it's the biggest or the largest ethmoidal air cell. So this again we'll discuss about bulla ethmoidalis in the anatomical class on ENT. But as of now, just remember that bulla ethmoidalis air cell is present within the this is present in the core of the ethmoid cell. Like I already told you, ethmoidal air cells is present somewhere within the middle turbinate region and the ethmoid bone. So in the ethmoidal meatus, in the middle meatus, this is present in the middle meatus. Like we have already discussed in our first class, if this is our middle turbinate, this is our middle turbinate. The area beneath the middle turbinate is considered as our middle meatus. So this region, the biggest air cell, the biggest anterior ethmoidal cell is called as bulla ethmoidalis. Bulla ethmoidalis has never been asked before, but just to complete the topic, so let's just cover this. So bulla ethmoidalis is the most consistent and the biggest ethmoidal air cell, and it is present in the middle meatus region. Coming to one of the options as in the question we have just projected is the concobullosa. Is the concobullosa. Concobullosa is nothing. It's not an air cell. It's not an ethmoidal air cell. Normally, usually, if you can observe here, this is our inferior turbinate, and this is our middle turbinate. Usually, turbinates are solid structures. It's bone. It doesn't have any hollow within it. If a patient develops a hollow or a air within the bone, air within the bone, and if that bone is our middle turbinate, then it's called as concobullosa. So it can be given a simple name as pneumatized middle turbinate. Simply we can just call it as pneumatized middle turbinate. A middle turbinate which has been pneumatized, nothing but air has been filled within the turbinate right now. So it's called as pneumatized middle turbinate. Or we can also call it as concobullosa. So concobullosa is nothing but a condition where the air is being filled within the turbinates, and it's a middle turbinate. If it is present within suppose the air starts filling in like this, and in CT scan we all know air looks dark in color or black in color. So if air fills up like this, then I'm going to call this as pneumatized inferior turbinate. We want to call it as pneumatized inferior turbinate. Same thing with the superior turbinate. In this cut, it is so anterior that the superior turbinate is not seen yet. Superior turbinate थोड़ा पीछे से start होता है. Like we already discussed, the turbinates are arranged in this fashion. In this fashion, so turbinates are arranged in this fashion. If I'm seeing the nose laterally, so this will be your inferior turbinate. मिडिल टर्बिनेट थोड़ा पीछे स्टार्ट होता है, एंड सुपीरियर टर्बिनेट बहुत पीछे स्टार्ट होता है, और सुपीरियर टर्बिनेट इज द वन व्हिच इज मोस्ट पोस्टीरियरली प्लेस्ड among the three turbinates, and it is very small. So superior turbinate is not it started in this cut. So I'm taking an anterior cut, and in this section superior turbinate is not seen yet. So if there air filled within the superior turbinate, I'm going to call it as pneumatized superior turbinate. Only pneumatized middle turbinate is being given a name, and that is called as concobullosa. Now, coming back to our question, like we just need to identify the anatomy, basic anatomy in this. So this will be my inferior turbinate, this will be my middle turbinate, and this is my superior turbinate. So this is nothing but air being filled within my superior turbinate. So the answer for my question in this scenario will be pneumatized superior turbinate. Let's try and identify the other air cell which is being given. Concobullosa is not present in this patient. The middle turbinate, the middle turbinate is not filled with air in this patient. So concobulosa is not an option. Very importantly, we'll try to identify two air cells in these. They're asking for onodi air cell. Onodi air cell cannot be identified. Just remember, onodi air cell can be identified in only cuts where sphenoid sinus is seen. We cannot see sphenoid sinus in this cut, so onodi air cell cannot be the option at all. So let's rule out onodi air cell. Onodi is not an option. And concobulosa, we have already ruled out because middle turbinate is normal. Where is halar air cell? Halar air cell, like I already told you, it's in the roof of the maxillary sinus. So this air cell will be my halar cell. And one more important cell which I can also see in this is my agar cell. This is my agar cell. And bulla ethmoidalis is this cell. Like I already said, it is present in the middle meatus region and biggest anterior ethmoidal cell, bulla ethmoidalis. So this was about the anterior ethmoidal cell, a small topic. The the only four ethmoidal cells is all we need to remember: halar, onodi, agarnase, and bulla ethmoidalis. And we need to remember that onodi is present posteriorly, all others are present anteriorly. So, guys, for today, this is just a small class on ethmoidal ASL, which I already missed out. So, this was supposed to be a part of the first class, but I had already missed out. So, I wanted to discuss with a question which was already been asked. So, this was a brief about the anti-ethmoidal cells and the anatomy associated with it. Let us cover about more topics about there are only two topics remaining in radiology. That is, one topic is nasopharyngeal carcinoma, and one more topic being the orbital cellulitis, which is again a complication of sinusitis. And there are few small questions based on glomus jugularis or glomus tympanicum and acoustic neuroma. And one question out of the blue was asked on CA larynx. So we'll discuss all three topics in our next and final final class on this radiology in ENT. Thank you.